In the current study, we found that serial NT-proBNP measurements were more strongly associated with incident HFrEF than HFpEF, and the stronger association with incident HFrEF was particularly pronounced in women. My name is Dr. Naveen Sudhakar, and I'm an assistant professor at the Department of Cardiology in Erasmus Medical Center, the Netherlands. Our study, titled Associations of Serially Measured NT-proBNP with Incident Heart Failure with Reduced and Preserved Ejection Fraction, will appear in the prestigious medical journal Mayo Clinic Proceedings. I would first like to thank and acknowledge all participants and co-authors for their contributions to this study. Heart failure can be classified based on left ventricular ejection fraction into reduced ejection fraction heart failure, HFrEF, or preserved ejection fraction heart failure, HFpEF. NT-proBNP is one of the most widely used biomarkers for the diagnosis and risk stratification of heart failure. It is released by the ventricles in response to myocardial stretch. While most studies rely on a single NT-proBNP measurement, this reflects only a momentary state of cardiac stress. Repeated or serial measurements can capture pathophysiologic changes over time, such as progressive myocardial stress, providing a more dynamic picture of an individual's evolving heart failure risk. In the current study, we examined associations of serially measured NT-proBNP with incident heart failure and its subtypes. For this, we used data from the PREVENT study, which included about 8,500 adults from the Dutch general population. Participants were followed for a median of approximately 23 years, and NT-proBNP was measured at baseline, after about 4 years, and again after 9 years. First, we observed that NT-proBNP trajectories began to separate several years before individuals developed heart failure. This separation of trajectories between those developing HFpEF and HFrEF was more pronounced in women than in men. Next, we found that increases in serial NT-proBNP levels were strongly associated with incident heart failure, with a stronger association for HFrEF than for HFpEF. Again, this difference was more pronounced in women. Based on these observations, we hypothesized that repeated NT-proBNP screening may help identify individuals, particularly women, at higher risk of developing HFrEF years before its clinical manifestation. Future studies are needed to test this hypothesis.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.